Lexi, thank you. This Saturday is World Hypertension Day, which is also known as high blood pressure. And this month is World Stroke Month. Your blood pressure plays a major role in your heart health, which in turn determines your risk for medical incidents like stroke. That's why medical experts are stressing the proper health habits to help keep you healthy. And here to talk about it today is Dr. Dan Lackland from MUSC. He's a hypertension specialist and a volunteer board member for the American Heart Association. Thank you so much for being here with us.
Much a pleasure.
Hypertension is a major issue because you don't necessarily feel like you're sick.
It's brilliant. Indeed, unlike weight, unlike even diabetes, things that make you feel bad when you have it, high blood pressure, there are no symptoms. Unfortunately, sometimes the symptoms, as you brought in, first symptom is a stroke or a heart attack or kidney failure. So it's so important to know, be aware of blood pressure and know your blood pressure.
So for whom is that important? Should everybody just go out and buy a blood pressure cup, or if you're predisposed to high blood pressure or it runs in your family, you need to check?
I think it's the first one. Everybody needs to know. A child, you would want to know, a mother and father should know the blood pressures of a child, because this tracks throughout life. If you kind of have high blood pressure at a young age, at adolescent, whatever, you're going to carry that on throughout. So this is something everybody needs to know. The beauty of it is the cost is not very much. You can buy a monitor, the whole family can do it, and that can be very important to keep those costs down, and then you can work with your healthcare provider and say, here's my blood pressure, and this is the direction we see.
All right, very good information. And Hypertension Day, why is that so important to bring awareness?
Well, for most of us, Hypertension Day is every day. But World Hypertension Day is one day that we can all recognize the importance of hypertension, high blood pressure, just getting that kind of awareness that, and with the theme, what is my number? Do I know my number and know what my number means? All right.
For those who say, I really don't want to be bothered with the doctor, no offense, but is there anything I can do to bring my own blood pressure down?
Absolutely there is. One, prevention is number one. Half the population, the adult population, would be considered hypertensive, half. But we know that we can control the blood pressure. You do have to go to the doctor for that and get a pill. That's when it's appropriate, that should be done. But weight loss, some things that we really know, reduction in our salt intake, a healthy lifestyle, physical activity, all the things we know can slow down and lower that blood pressure.
And how much does family history have to do with it?
It has a great deal, but again, most all of us, both of my parents were hypertensive. I'm hypertensive, and so that certainly plays a role, but there's really no one that does well with elevated blood pressure, so everyone needs to know their numbers and how we can keep those blood pressures low.
It's a serious thing, so we need to be aware of it, and like you said, know your numbers. Thank you very much, Dr. Dan Lackland, for being here with us. If you'd like more information on heart health and high blood pressure, head over to live5news.com for us and click on the big red box. There you'll find the American Heart Association's website with all of that information.